Why it is considered as Breast Cancer Awareness Month. According to the Center for Disease Control and Prevention, breast cancer is a menace which befalls mainly women in Africa and accounts for the high rate of global cancer-related deaths in women and with about 11% in men. Given the continent lacks technology to battle this disease as compared to the Western world, mortality rates are disproportionately high. Over the years, the disease has surfaced in young women despite the awareness created so far. Today, we will try to find answers to see if the African continent is up to the task. Stay with us. Good day, ladies and gentlemen. Thank you immensely for joining us on Fresh Dose of Voice over your Pan-African channel for you Media Africa. Today we are discussing breast cancer. As we earlier mentioned in our introduction, October is considered as the awareness month for breast cancer across the globe. And today we are trying to find answers if the African continent is of course up to the task when it comes to battling this health challenge, which doesn't just befall women, but also, of course, it befalls men as well. And this afternoon I will be joined by our seasoned guest. We have Dr. ASONG Michael Kumar, who is a medical doctor as well as a legal expert. He's joining us all the way from Rwanda. Good day, sir. Dr. ASONG, good afternoon. Just shortly, we shall be getting information from Dr. ASONG. Time I equally welcome ABBEYTAKOR ATONG. He is a medical in training, a global youth ambassador, as well as an SCG coordinator. Good day to you, Mac.
Good day, Sharon. Thank you for having me in your program. I'm really delighted to join you again. Thank you.
If we have Dr. ASONG with us, I would like to welcome you to the program, sir.
Thank you, Sharon. Thanks for the invitation.
Before we proceed to getting down to understanding what breast cancer comprises, the causes, the symptoms, and definitely, if there are possible treatments, I would like you to take a listen to this report done by the news desk of For You Media Africa. And of course, this comprises what breast cancer is all about. Take a listen. Health burden in sub-Saharan Africa as it accounts for high rates of global cancer-related deaths in women. Although the disease incidence in Africa seems lower, mortality rates are disproportionately high in comparison to high-income countries. Doctors say breast cancer occurs when breast cells begin to grow abnormally. These cells divide more rapidly than healthy cells do and continue to accumulate, forming a lump or mass. While the records of cancer linked to gene mutations pass through generations of a family. Statistics illustrate in Africa, breast cancer is responsible for 28% of all cancers, 20% all cancer deaths in women, and about 11% in male. Incidence rates are still generally low in Africa, estimated by 35 per 100,000 women in most countries, as compared to over 90 to 120 per 100,000 in Europe or North America. Precise incidence figures in Africa are lacking given the absence of cancer registration in most African countries. According to the Center for Disease Control and Prevention, some of the symptoms are lumps in the breast or underarm, thickening or swelling of parts of the breast, irritation or dimpling of breast skin, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk including blood, any change in the size or shape of the breast, pain in any area of the breast. Nonetheless, breast cancers could be treated depending on the type of breast cancer, its stage and grade, and whether the cancer cells are sensitive to hormones. Amidst all these, one can't help but ask if Africa is up to the task. Is Africa truly up to the task? That is what we shall be finding out in today's edition of Voice It, as we are talking today breast cancer, not just in Africa but at the globe at large. And having listened to that report, the first question I'll be asking this afternoon is directed to you, Dr. ASONG. Having listened to that, could you give us a brief understanding of what breast cancer is all about? Dr. ASONG?
Breast cancer. So breast cancer can actually be defined as a disease characterized by the development of abnormal cells in the breast tissues. So these abnormal cells actually develop in a disordered manner, and actually they lose their functioning and they create some sort of mass. The end goal of this mass is that it actually causes the organ failures and also malfunctioning. And this will lead to the spread of these tissues to other organs that can actually cause the death of the woman in question. Like it can go to the lungs. So when it attacks the lungs, automatically the woman will not be able to breathe very well, and it will take away her life. It can also cause anemia and other very painful symptoms. So that's what breast cancer is all about. It's worth mentioning that breast cancer is not only a public health issue, that is actually an issue or a health condition that is being localized to a particular population or a particular country. But breast cancer is a global health issue because it touches so many countries and it is worldwide. It's a global issue because global solutions are being sought in terms of research, in terms of treatment, in terms of diagnosis to be able to resolve breast cancer. So that is the reason why it's important for us to have the different statistics in Africa to be able to see how we'll combat this disease that actually violates the right to health of the woman. And it is worth mentioning that the right of the health of the woman is a priority. That is why we have international conventions for the elimination of all forms of discrimination against women. And in its Article 10 and 14, there is a precise consideration and a precise policy and mechanisms that has to be put forth by states to be able to inform, educate, and protect the health of women. Moreover, it goes in line with also the African Charter of Human Rights and the rights of people relative to the rights of women. And it also provides of 2002 and it also 2003, sorry, and it provides for the protection of the health of women. So the analysis that we are making today concerning breast cancer is that it's a serious global health issue and it actually affects the rights of health of women who today are in some way or the other being neglected in our African societies because our African societies are more patriarchal, and more to that, they don't put a lot of emphasis on the protection of the rights of women. So it is worth for us mentioning that breast cancer is a violation of the right of health of women. And that is why we are here today, to say that it is a global crisis, to say that it is a real issue, and that we have to take it into serious consideration, work hand in hand to resolve the issue. So everything you've said about the statistics, the incidence, the prevalence of breast cancer in Africa is quite true. It is worth mentioning that in the world today, in 2020, the World Health Organization mentioned that over 685,000 women died of breast cancer. And Africa alone contributed to about 85,000 deaths. It is also worth mentioning that the survival rates in Africa are very low. They are lower than 30%. Whereas in developed countries, they are above 60%. So these are the issues that we have in our African societies. We have lack of information and statistics, actually documenting breast cancer. You will not imagine that out of the 47 sub-Saharan countries, only 20 African countries had registries to document breast cancer. So we are left with the question to even know if the statistics we are having about breast cancer are really true. Because if there is no registry, how do we trace the morbidity and the mortality rate which are associated with breast cancer? So more to that, we have our population, or we have women who are not, the government has not put in place mechanisms to educate the women. So you realize that most women come to the hospital at a very, very advanced stage. And notwithstanding, we don't have the adequate health infrastructure to be able to manage this breast cancer. We take into considering the fact that we don't even produce drugs, hormonal drugs, hormonotherapy drugs for breast cancer. We only have one radiotherapy machine in Cameroon and in the whole of Central Africa, because patients live from Chad, from Gabon, from Central African Republic, from Equatorial Guinea to come and get treated through radiotherapy in Cameroon, which is one of the type of therapies which are being used. More to that, we have a community which is quite poor, and due to the fact that women don't constitute part of the majority of those working, it actually creates some sort of economic dependence, economic economic hindrance on the women who are not able to access healthcare due to the cost of healthcare. So we have to know that the cost of actually treating cancers and breast cancers is actually high. It is true that the state of Cameroon is doing its best to subsidize the treatment for breast cancers, but that is not enough. When we go further, we'll realize that enough sensitization is not being carried out towards the population to educate the women on how they can personally screen and know the different symptoms of breast cancer, and even carry out an auto palpation of their breast to know if there is an issue and report immediately to the hospital. So when we look at all of these things, we realize that we have to work harder, and we have to work hand in hand to be able to resolve this global health issue, which is breast cancer in Africa.
Very detailed introduction there, Doc. Okay, to proceed with you, Mr. Atong, the question I would like to ask you is, having heard to what Dr. Asong said on giving a brief introduction of what breast cancer is all about, in your opinion, what are some of the causes of this health challenge that many people are facing around the world?
All right. Thank you so much, Sharon, and to my co-panelist, Dr. Asop. I'm really amazed and inspired by his detailed introduction. Now, some of the causes, generally, like he said, breast cancer basically is uncontrolled proliferation of the breast cells, which sometimes metastasize through the breast to lymph nodes, and of course it begins with cells in the milk producing ducts, such as invasive ductal carcinomas, or at the level of the lobes, such as invasive lobular carcinomas. And well, some of the factors also can arise with respect to our interaction with the environment, our lifestyle. There are persons who, live extravagantly in the way that they do carry out their activities. So with respect to that, it also influences their risks of getting cancer as well. And also being a female also predisposes you to being to having cancer. And I want to note here that Males also have breast cancer, but it's more common in women than in males. So being a female, of course, predisposes you to breast cancer. Also, your age, increasing age, also predisposes you to breast cancer. Obesity also predisposes you, and past medical history of breast cancer. If a biopsy of breast cancer has been done and it signal that you have say some lumps growing, a benign, and it's not say for example a stage 1 cancer, and it's not attended to immediately, it then results to further development and it can go to the irreversible stage. So those are some of the causes that I can put together.
Okay, thank you so much for that. I believe that someone at home might actually get to know what could be the causes and definitely get to the hospital as soon as possible. But then I would like to come back to you, Dr. ASONG. Having listened to what Mr. Atong said, is there any first symptom that any lady or any man watching this program at the moment should actually watch out for when it comes to detecting breast cancer at a very early stage?
Okay, thank you, Sharon, for that question. As a matter of fact, when it comes to screening breast cancer, we usually make use of radiological examinations. So you have mammography, you have echographies, but most of the time, according to world and health standards, it is being used more for those who are above 50 years. Because as earlier said, my co-panelists, that age is one of the factors or the factors which actually expose women or men, which is very low in men, breast cancers, to a breast cancer. So most of the time, that is what is used, a mammography. But then we have to consider the fact that we are in a developing world, and in developing world we lack a lot of resources. So it therefore means that to have every woman do a mammography will be quite costly, because we will not have the means to be able to provide that service for all women. So nevertheless, the strategy which has been put forth is that of carrying out an auto screening by the woman. So an auto screening will actually comprise of the woman actually considering certain symptoms that can actually evoke breast cancer. So what are these symptoms? So you can have an impression that your breast is swollen. So your breast will increase in volume, like it will not be normal as the way it used to be. Secondly, the breast skin can change in texture. So it can become hard. It can look like the skin of an orange. So that is another symptom which the woman can notice. Another symptom is that the skin can change color. Usually the skin has a normal color, but then when there is a breast cancer, you can have some sort of a reddish skin. We call it erythema. So it actually means that there is an issue with the breast. Another symptom is that the woman can realize that she is seeing some sort of secretions coming out from her breast. So most of the time, these secretions are bloody in type, but they can also be purulent, means like pus, or they can be serous. So those are the main symptoms that a woman can realize. Sorry, I'll also add pains. The woman can also feel pains in the breast. So when the lady realizes that she has these symptoms, what she needs to do next is to go over to do an auto palpation of her breast. So it is worth mentioning that the breast has 4 regions, and there is another part of the breast called the tail of Spence. So actually that part is an extension of the breast towards the armpit. So what the woman does then is that she will actually palpate her breast, but she will start from the armpit. So she starts from the armpit and she tries to touch to feel if she's going to get any lump or something like a nodule in that region. So she will progressively go around the breast in a circle till she reaches the nipple. So what is she looking for? She's looking for a mass or a lump. She's looking to see whether when she will palpate or press on the breast, there will be a secretion, a bloody secretion that will come out from the nipples. She's searching to realize if when she touches her breast, she's going to feel any pain. So this is the means by which a woman can personally carry out auto screening. And it is extremely important because we have realized that most women arrive in the hospitals at a very late stage. So it means that they had been keeping most of these symptoms for a very long time. It is worth mentioning that one of the traps with breast cancer is that when there is a breast cancer, there is hardly a pain. So a woman can feel a lump, she can even feel that the texture of her skin has changed, she can even have some secretions, but it's not painful. And most of the time, when it is not painful, the women might feel that, okay, it's something that will go, it's something that will pass, but unfortunately, it's a cancer. So women have to really learn how to carry out auto-screening themselves and to know that breast cancer is a very dangerous disease. So when they realize any symptom or any sign when they carry out palpation, they should immediately report to a public hospital or a private hospital and see a medical doctor who will confirm the diagnosis by carrying out a proper clinical examination and actually ask them to carry out the required tests which are necessary to confirm the diagnosis, such as a mammography and a breast echography. So that is what women have to know, and it is very important for them to always bear these things in mind.
So you did mention of mammography as a test through which they can detect if they have breast cancer or not. I don't know if you could better elaborate on the terms so that any person that really doesn't understand could better know what it's all about.
So actually, mammography is a type of radiological examination, which it makes use of an X-ray. So it makes use of X-rays. And what the X-rays do is that they cut through the body of the skin, and dense areas or areas which are abnormal will present themselves on a film, which is like a picture with different densities. So most of the time, they will look very clear and whitish, and it shows that there is actually an issue with the breast tissue and that there is a mass. So that will help to diagnose that there is a mass in the breast. And after that being done, the doctor will prescribe an echography to actually see which type of mass is in the breast. Is it a liquid mass? Is it a hard mass? And from there, he's going to ask a biopsy. A biopsy is some sort of puncture in the breast that will pick up tissues in the breast, and they will carry out an anatopathological examination that will confirm breast cancer. All lumps in the breast are not obviously cancers because we have what they call benign tumors, but cancers are malignant tumors. So that biopsy will help to confirm then the diagnosis. Then from there, depending on the medical doctor who receives the patient, if it's a general practitioner, automatically he or she will have to refer the patient to a gynecologist who is the specialist, actually the appropriate specialist to manage breast cancer issues.
Thank you so much. Just to proceed with you, Mr. Atong, medically it is said that when ladies age, they are prone to having breast cancer. Like you earlier mentioned before, when ladies age, definitely they can have a breast cancer. But I would like to have a clarification. At what age precisely can a lady really get this disease?
All right. Thank you so much. Basically, it's very, very common with women aged between 35 to 35 and above. Yeah, though some cases still that presents at the level of the hospital. We see some women, some young ladies, 22, 20. 25 still present, though they are very, very rare, very few. But most cases, like I said, 35, but you mostly see them between 45 and above. So that is also a factor. And well, I will just also extend by saying that with respect to the diagnosis, there is really a barrier with respect to the diagnosis of breast cancer, given the stigma that the breast cancer poses. You know, when a young lady, imagine a young lady of 28 has reports to a friend that she has breast cancer, imagine the stigma. So she'll be like, oh, so small that you go die. So that is what usually happens. And when they have that at a very, very tender age, say a lump on their breast, they tend to hide it. And as my co-panelist, the doctor said, they tend to keep, because of that stigma, they tend to hide that lump rather than reporting it to their doctor. So it progresses from stage 1, and when it gets to a very critical stage, following the TNM system, the stage of classification of cancer, it gets to the 4th stage, which is one of the most critical stages. It becomes really too late. So this also is very important for our public health experts and even our doctors to really work to see to it that barrier with respect to the diagnosis and the free expression of the fact that you have cancer should be ruled out. Yeah, I think if that is done, and also like my co-panelists also mentioned, most women are really, really economically down. Some of them will not really have the finances to go do radiologic examinations like mammography, ultrasound, and the rest. So most of them are also hindered in that aspect. And some of them feel that, okay, when I go to the hospital and the doctor will examine, he may tell me what I don't want to hear. So instead of them going to the hospital to check, they will just, to examine their breast, they will just sit back and say, no, everything is well, it is well, God will take control, in quote. And they end up facing really great challenges. So that stigma, that barrier really needs to be ruled out if we are to ensure that proper diagnosis of breast cancer is concerned. It should not be a stigma like I'll still go back to what my co-panelist said, because he has really spoken elaborately. He said it's a global crisis. It's not something that only affects the less developed world. It affects even the developed world. As a matter of fact, after lung cancer, what affects the cancer that affects most is breast cancer. So it should be approached in that way. Women should not be stigmatized when they see themselves having breast cancer.
Yeah, you cited a lot of points, but then I want to come back to what you said. You said the ladies are, so to say, between 22 and above are sometimes detected of breast cancer. What do you think account for this?
All right, some of them, you have their environmental factors, like I mentioned earlier. Environmental factors account for this to a greater majority. You also have other factors like genetic factors, where inherited factors which are genetic also affect most young ladies. You see a young lady, say of 25, you are like amazed. But if you really deep down into our past medical history, you discover that there is a history of breast cancer, maybe from the mother, from the grandmother, from the auntie, and so on. So all of that also accounts, even their diet, eating a lifestyle, how they eat. And you see most young ladies nowadays, you see most people consuming shawarma. I'm not really downgrading on the business of
Mr. Atong, are you with us? So we're going to proceed with you, Dr. ASONG, this afternoon. Having listened to what Mr. Atong said earlier, which we are hoping he shall be joining us subsequently, I'd like to ask you, what are the modes of prevention, especially for young women and young men, when it comes to getting away from this medical challenge which is affecting many people in Africa?
So, as a matter of fact, concerning prevention, the first thing that has to be done is that a lot of research has to be carried out in our society to be able to evidence determinants and indicators that actually expose to breast cancer. So when we talk about determinants are all those conditions that actually cause a health condition or make people to be better. So most of these determinants, we have to cite them. They are the economic context. We have to talk about access to care. We have to talk about education. We also have to talk about the different policies which are being put in place to actually fight against breast cancer. So when we look at these different determinants, when we look at these different mechanisms, from there we can know how we can actually prevent breast cancers. So the first thing we have to take into consideration is that when it comes to preventing breast cancer, after having the different statistics, that is knowing how many people are being detected of breast cancer each year, the mortality rate, the cause, the time of arrival at hospital, all those things will help us to know how to educate the women. Because as I earlier on said, one of the issues we are having is that most of the women come to the hospital late. So it means that screening is not properly done on time. And if screening is not done on time, mechanisms will have to be put in place to be able to help women be able to screen breast cancer early enough. So it starts by education, actually trying to educate the woman or the girl child to have more knowledge about breast cancers and how they can diagnose symptoms or realize symptoms of breast cancers, and that they should report immediately to the hospital. Now, the next thing is that they are environmental determinants. So when we talk about environmental determinants, we talk about all those conditions in the environment that expose to diseases. So we'll talk about pollution, we'll talk about feeding habits and the type of food we take. We'll talk about also the impact of disasters on the health of women. So when we take into consideration pollution, we'll talk about smoke, not only smoke from industries, but also smoke that comes from women who actually use fire sites in the villages. We talk about also women who smoke. So those are actually environmental factors which can actually expose women to breast cancer. So we have to act upon them. So the state will have to put in place measures that will limit the emission of waste products into the atmosphere that can expose women to breast cancer, to also limit the way people smoke in public, because it's not only the person, the active smoker, but also the passive smoker can also be affected. So the state will have to put in place all those mechanisms to limit environmental hazards. More to that, the state will have to improve on the quality of education of the girl child, because we know that those who are poorly educated automatically are those who are more like not conscious or ignorant of certain health issues and symptoms, and those are mostly the ones that are more negligent and don't go to the hospitals on time. So more to that, the state will have to encourage activities, sport activities, like my co-panelist earlier said, that one of the causes, or sorry, not the causes because we don't have causes, but we have risk factors. And one of the risk factors is actually sedentary lifestyle. So even feeding methods will have to be ameliorated. So we have to go towards more organic type of food instead of inorganic. So all these things will help to prevent breast cancer. The state will have to put in place very good government policies to be able to install different healthcare and make healthcare very accessible to all the population. So we have primary healthcare units, secondary healthcare units, and tertiary healthcare units. So the state will also have to put or actually create committees that will be able to go down to the field and do community sensitization so that women will be more aware of breast cancers. Moreover, the state will also have to invest on the quality of healthcare, because as I earlier on said, we only have one radiotherapy machine in Cameroon, and that machine is not even functioning very well. It is quite old. It's not even a latest generation, and it has to serve all Cameroonians and the whole of the Central African Republic. So the state will have to invest more in healthcare to provide quality healthcare to all individuals. So we are not only supposed to have one radiotherapy machine in Cameroon, but we are supposed to have others. Moreover, the state will have to train more gynecologists, radiotherapists, and oncologists, which are the specialists who actually manage breast cancer. So they have to train more of them so that we'll be able to treat the breast cancers if the women actually realize that they have an issue. So these are all the methods that will have to be put in place by the state: educating, putting in place good health policies, working on the different determinants, and also creating a good healthcare system that will be able to manage diseases. As I earlier on said, survival rates for breast cancers are lower than 30% in Africa, whereas in developed countries, the survival rates are above 60, 70%. So as my co-panelist said, in developing countries, breast cancer is not a fatality per se, because they have the means and they have the adequate, they have put in place adequate services to be able to diagnose fast and to treat quick. And even those at a quite advanced stage can benefit from very good treatments and actually prolong their lives, which is one of the aim of global health: equity, quality, and prolonging the life of people in general. Thank you.
Okay, but so I'm a little bit curious. I would like to find out, for how long can someone stay with breast cancer without actually knowing?
Well, it all depends on how the breast cancer develops. So they are actually, cancers in general are actually chronic diseases. So somebody can keep a cancer maybe even for a year or two. But that depends on the type of cancer. That depends on the location also of the breast cancer. But as I earlier on said, the issue is that most women don't feel pains. So since they don't feel pains, automatically they don't feel the need to come to the hospital. We have seen situations, very dramatic situations in our hospitals, where a woman will arrive in the hospital with a breast that is completely rotten, a very large ulcer, and a very big mass which is completely rotten. So sometimes you ask yourself, but how can you stay home with such a thing. So they'll tell you, no, they thought it's going to go. Might be they went for prayers. Might be they went for traditional doctors. And that is also one of the issues we are facing, because our population don't trust the healthcare system. And that is something that the government will have to work a lot on it to help the population get closer to their health professionals, and also make the health professionals go towards the population, so that there should be some sort of dynamics between the two, and that will actually help to prevent diseases. So concerning how long a woman can stay with breast cancer, it all depends on the type, and it can even go for years, and it can even be as less as months. All depends.
Yeah, so you're equally a legal expert. Earlier on, you cited that breast cancer consequences are a violation of women's rights, and specifically their right to health. Could you elaborate a little bit on that?
So actually, when it concerns the right to health, the right to health is first of all recognized as a human right. So a human right is actually a right or a privilege which is inherent to all human beings and cannot be alienated. So it means that every human being is born with this right. So we are all born with the right to health. So in the case of women, we have to understand that more emphasis has been made on the right to health on women, due to the fact that women have been discriminated upon in the society, they have been marginalized, and actually their status have made it difficult for them to have the right to health. So the right to health will entail access to health care, will entail access to the right of education in healthcare concerning diseases that are related to the women. It will have to do with the right of the woman to be able to make her choice of what she wants for herself, for her body, concerning contraception. It also has to do with the choice of the woman to go to a particular doctor for her treatment. You wouldn't imagine that in certain African countries today, some married men believe that women are only supposed to be consulted by female medical doctors. And we see that mostly in the Islamic context. I've experienced so many cases where people had to, or men had to send their women for consultation in Cameroon from Chad. So you can imagine, because at the time, they never had any female gynecologist, they had to send their women to Cameroon. So that is already a violation to the right to health, making health not accessible to the woman, making the woman not being able to access the best healthcare, because might be one of the best gynecologists or the only gynecologist in town is a man. But because you don't want the woman to be consulted by a man, you are forced to send the woman to a general practitioner who has little knowledge about gynecological related diseases. So we clearly realize that these are the different elements that form the right to health of a woman, and they are being expressed in the Convention for the Elimination of All Discrimination Against Women of 1979, which clearly states that women should have access to healthcare facilities, because that is one of the issues, because women don't have access to these healthcare facilities. Another thing is that the healthcare facilities are not appropriate enough to take care of the health-related issues that women encounter every day. For example, I just told you that to diagnose a breast cancer, you need mammography, but you realize that X-rays are only in cities, whereas they are supposed to also be in the different districts or different regions and departments or subdivisions in a country. So these things are being expressed in international law, and the international conventions place a special privilege upon women, and their rights really have to be protected. So not only the UN organizations have to play their role, for example, the World Health Organization, but countries too individually have to play their role in ensuring proper health care to women, in ensuring and protecting the right to health for women. We have to also mention that the conventions, international conventions, which are related to the right to health care for women, are not actually being respected by most of our African countries because they don't give priority to the right of the right to health care of women. So our states will really have to take an important step in protecting this right. And considering the fact that breast cancer is a global health issue, and actually not only due to the fact that it violates this right, it also can cause death. So death, the right to life, is another human right. So you see that the right to health can lead to a violation of the right to life. It means that the woman can lose her life, she can die. It also leads to a violation of the quality of life of the woman, because a woman who is sick, of course, will not be able to participate in the development of a country. So automatically, the African continent as a whole, through the African Union will have to work together hand in hand in order to bring member states to recognize and to put forth their obligations in protecting the right of health for women. So we have to note that in the African context, we have the African Charter for Human Rights and the Rights of People relative to the rights of women. So we have a charter that actually seeks to implement that right to health in our African context, amongst other rights which are being attributed to the woman. But the right to health is one of the most important. And they have actually prone through this, or encouraged through these conventions, access to healthcare, education in healthcare, equity in healthcare, and quality.
Okay, Doc, earlier on, Mr. Atong, he cited that there's this stigma attached to breast cancer. Now we find ourselves in an era where the young generation barely go to the hospital when it comes to checking their status, of course, knowing their status. Now, if you had to give a message out there to this young generation, given you are a medical doctor in the field, you know what's on ground, what would that be?
Well, the advice I can give to our young people is that breast cancer, and to our young women, is breast cancer is not a fatality. Breast cancer can be treated, breast cancer can be cured. But that entails your participation as a woman, your participation as a citizen in diagnosing and screening breast cancer early enough so that healthcare practitioners can be able to take the appropriate measures and medical treatments to be able to squash and treat breast cancer. We have to know that the woman has a special place in the society, and that without the participation of the woman, automatically we can't have a developed society in Africa. Breast cancer is one of the leading causes of death amongst women in Africa, and that is quite tragic. Our young sisters, our mothers, and our grandmothers must know that if we work together hand in hand, if they listen to the advice of health practitioners, the education which they give for prevention, and also how to conduct screenings, then automatically we'll be able to detect, we'll be able to prevent breast cancer, we'll be able to detect it early enough, and we'll be able to treat it. So it entails all of us working together, and we should not also always think that it is the state to do everything. We have to know that we have our own personal responsibilities, considering the impact of the global impact of breast cancer in the world and also its national impact.
We want to see this health challenge finally come to an end. It's on that note I would like to ask you, given the collective effort that is required of everyone so that we put a stop to breast cancer, though that will require the medical field putting in a lot, do you think the African continent is really up to the task?
As a matter of fact, for now, the African continent has a lot lacking behind, because the first issue we have is that we are not united. Actually, to tackle breast cancer as a global health issue, we need to do a lot of research. And this research does not actually require that, or must not require that we act individually, but actually requires that we should act collectively. So the gynecologists and health practitioners who are specialists in female reproductive diseases should actually come together as a whole to seek solutions and to seek different methods of treatments that will be appropriate in preventing, promoting health, and in treating breast cancer. So we really need to work together, and that is why the African Union has a great role to play here, to remind member states that there is the possibility for our African countries to bring in all the intelligent medical minds and legal minds to be able to come up with an appropriate program and policies to be able to tackle breast cancer. It is worth mentioning that the World Health Organization actually says that in 2035 the numbers will double. So it's a real issue, and the manner in which we take the issue now would actually permit us to be able to resolve future complications and global impact. And that is why we have to work a lot together, doing a lot of research and coming up with appropriate preventive mechanisms that will encourage women to do what is correct so that they are not exposed to breast cancer. And even if they happen to have breast cancer, they should be able to diagnose it early enough so that the health practitioners will find it easy to treat them.
Very, very interesting conclusion there. I'd like to say thank you immensely for shedding more light on this medical challenge which is affecting the globe at large.
Thank you very much, Sharon, and good day to our viewers.
Just to reiterate, Dr. ASONG Kumahe is a medical doctor with the Cameroon here in Cameroon, of course, and he is a lawyer with the Rwandan Bar Association. Ladies and gentlemen, we were equally joined by Mr. ABBEYTAKOR ATONG, who is a medical in training, a global youth ambassador, and of course, he contributed equally to this edition on breast cancer Voice It. Ladies and gentlemen, we are gradually drawing down the curtains of today's edition of Voice It over your Pan-African channel for you Media Africa. I have been NJIX NABESEH for presentation. Stay in company of our programs.